Why is mouth breathing bad? Mouth breathing is an underdiagnosed and underdiscussed health issue that we really need to be paying closer attention to. Whether you're a parent, a healthcare provider, or adult that spent their entire life breathing through their mouth like me, we need to know why it's such a big deal. Mouth breathing starts when we don't get enough air through our nose, oxygen, and our mouth takes over. When we don't get it through our nose, it forces us to breathe through our mouth out of sheer necessity, and it becomes a lifelong habit if not corrected. It starts with awareness. We don't give much thought to how we breathe. It's something we do naturally. It's automatic and not automatic at the same time. Respiratory function is controlled by the brainstem, the part of the brain that controls the basic needs to keep us alive, like our heartbeat. Breathing, we don't think about it. We still breathe when we're unconscious, sleeping, or even anesthetized. Just because breathing is an involuntary function doesn't mean humans are unable to control it. If you've ever been able to hold your breath before receiving a shot at the doctor or when something scares you, it's in part because emotion and something unconscious affects our breathing pattern, and it brings down our oxygen level and increases our anxiety. You breathe without thinking about it because your body does it automatically for you. Things can change. Your breathing patterns can make you feel short of breath, anxious, ready to faint. Fight or flight kicks in. Sometimes this happens, and if you're over breathing, it's called hyperventilation. It's important to realize that mouth breathing and having an open mouth are the same thing, and they're equally as detrimental to your health. You can see in the picture the difference between a nose breather and a mouth breather and how it affects your facial growth and development. I've said it before. When you breathe through your mouth, you get 18% less oxygen to your brain and your body because you're not getting that nitric oxide CO2 exchange that we talked about in the last video. Oxygen is the one element our body needs to survive and thrive. We can't survive without it for more than 6 to 10 minutes, usually 4 to 6 minutes, but there are situations when if your body temperature is brought down, you can survive 10 or 15 minutes. We need it. It's perfectly natural to breathe through your mouth for certain times. If you're exercising, if you're lifting a heavy load, if you have allergies, if your nose is stuffed, if you're sick. We're lucky that we have this option of breathing through our mouth, but breathing through our mouth most of the time, chronically, causes health problems. Mouth breathing also has a certain stigma attached to it. If you're a mouth breather or someone calls you a mouth breather, it's meant as a derogatory comment. And for some people, it's embarrassing, but it's not something you should be embarrassed about. It's something that we should understand, learn more about, and treat. In just the same way like you would treat any other health concern, it's important to take charge of your health, learn the symptoms, become familiar with the risks and problems associated with mouth breathing. Did you know mouth breathing is a risk factor for sleep apnea, for obstructive sleep apnea, for ADHD in our kids? If you breathe through your mouth, you're more likely to have allergies, inflammation, and digestive issues. 30 years ago, I didn't know any of these things when I was trained as a dental hygienist. Even worse, I just learned that I was a mouth breather during the day, probably about 2 years ago, because I was having sleeping issues. I was getting up 3 or 4 times in the middle of the night. My daughter was having dark circles of her eyes, behavioral issues. They wanted to put her on ADHD medications, and I knew that she was sleep deprived, but I didn't know why or what to do about it. She was wetting the bed. Now I know it's a form of a sleep breathing disorder. She was waking up, tossing and turning. Her pillows were on the floor, wetting the bed. And when she finally went to sleep, she wasn't getting enough sleep. I was waking up with a headache, a stuffy nose, a sore throat, a dry throat. And I thought my bladder was waking me up. I was waking up exhausted. How could it be my mouth that was causing these issues? How could both of us be waking up tired? I thought we were getting sleep, but guess what? We weren't. So why is mouth breathing bad? Mouth breathing should be a huge red flag for sleep disordered breathing, sleep apnea, allergies, impaired craniofacial development for our kiddos under the age of 10, for TMJ disorders, for digestive problems, for sleep problems, for asthma, for periodontal disease, for gingivitis, for dental cavities, all of these orthodontic complications too. If you have mouth breathing or a tongue thrust or a tongue tie, you could have worn braces 2 or 3 times. If you don't correct that habit, then your braces will relapse. Your teeth will go back. You'll have crooked teeth again. Your teeth will start shifting. You could have many of these symptoms and not realize that that is the problem. Allergies, chronic nasal conditions, asthma, deviated septums, polyps, adenoids, tonsils, all of these things can affect you. And each of these factors can make it physically impossible for a person to breathe through their nose. If nasal breathing is not possible and we don't address these systems, the body has no choice but to breathe through your mouth. If you can't breathe through your nose for 2 to 3 minutes, you really should see an ENT and figure out why and get that fixed. How does mouth breathing affect your body? Mouth breathing has a number of detrimental effects, starting with your tongue. Where is your tongue? Mouth breathing changes the way your tongue works and rests in your mouth. Your tongue should rest on the roof of your mouth. So where is your tongue when you're sitting here right now? Is it just floating between your teeth? Is it resting on the bottom against your teeth? Is it on the roof of your mouth? Your tongue should naturally rest on the roof of your mouth, just naturally. A lot of times it rests on the bottom. If you're tongue-tied, it probably rests on the bottom. If you're a person that builds a lot of tartar and you have that open mouth posture, it can actually lead to underdeveloped oral musculature. It can cause weak muscles of the face. It can cause problems with speech, swallowing, breathing, chewing, digestive issues. When your tongue rests low and you have a low tongue posture and you have low tone, you can have a tongue thrust swallow where your tongue goes forward, also called a reverse swallow. And that's going to affect gas. Mouth breathing, tongue thrust usually go hand in hand. If you're mouth breathing, you might have a tongue thrust. If you have a tongue thrust swallow pattern, you're probably a mouth breather. Facial growth and development, believe it or not, breathing through your mouth changes the shape of your face and alters your appearance. It's especially true for children when they're growing. Children who are mouth breathing, if it's not corrected, can suffer from abnormal facial growth and development. They could have more crowded teeth, longer faces, dark circles under their eyes. They use their chin or their lips when they swallow. Like less defined cheekbones, smaller lower jaw, a weak chin, a cheek that's kind of tucked back, forward head posture, kind of looks like it goes into your back. They might have a gummy smile. Again, you can look at the picture and see all of these things affect your body. Using your mouth for breathing disrupts the natural body mechanisms. The root of the problem is caused from oxygen deprivation that affects many other bodily functions. So you could have symptoms like headache, gingivitis, sore throat, cavities, always feeling like you have a cold, congestion, bad breath, poor sleep, chronic fatigue, digestive issues, more gas, more stomach upset, irritable bowel, getting up and going to the bathroom, reflux, not being able to swallow pills. It can be linked to poor growth, to weak academic performance, to ADD, to ADHD symptoms. In adults, poor oxygen and lack of concentration can affect how you work, how you focus. It can be associated with high blood pressure, with sleep issues, other medical conditions. If you're pregnant, it can cause low birth weight or preterm delivery if you're a mouth breather. In addition to breathing through your mouth, it can have spinal and postural changes if not corrected early enough. If the tongue is in the wrong position, the head tends to be forward and your shoulders are slumped, so your tongue's the most common obstruction. It makes it more difficult to sit up straight, especially if your tongue is blocking your airway and your tongue is connected all the way to your toes. Mouth breathing affects your teeth and your bite, especially because of where your tongue is. Your lips are weaker. Your cheeks are weaker. You have less support. Form follows function. Again, your tongue pushing up is going to make you have a wider arch and you're going to breathe better. When it pushes forward, it's going to push your teeth out. We swallow 1,200 to 2,000 times a day with a pound of force on the teeth. So think if your tongue is pushing forward, why this would cause problems with your teeth. Time in braces could be longer if you have that habit. The results might not be permanent. Even though you wear braces, you could have a relapse. So what happens if we continue to breathe through our mouth? As the tongue grows through childhood, resting on the roof of your mouth, you have a wider arch. It forces the pressure to be up on your roof of your mouth instead of on your teeth. So you can see why it would change how you grow and develop. Where that support is, where that force of your tongue is where the form follows the function. If the tongue is too big to fit in the roof of your mouth, the child now has an underdeveloped upper jaw, and sometimes the lower jaw comes out in front, and that's called a class 3 bite. It creates overcrowding, malocclusion, difficulty breathing. And if they have that before they get their adult teeth, there's no room for their adult teeth. And when I was a teenager, they extracted teeth, and that's not good because now it's collapsed me even more. And now my airway is even smaller. So taking out teeth to fit is not good. We really want the palate to expand and make room for our tongue. When you take out the teeth and you don't make room for the tongue, that's going to be a problem for your airway. And we need the airway to be open and bigger to be able to breathe. So that's why sometimes traditional orthodontists telling you to wait till kids lose all of their baby teeth is too late. Mouth breathing in children affects jaw development and facial structure as a direct result of where your tongue is. Creates poor growth of your airway. And sometimes the body can correct and compensate, but sometimes it can't. It compensates by moving your head forward and doing things that are not going to be good as you grow and develop. It can affect your pelvis, and your pelvis can be tipped forward as well because it affects your breathing. You're using your chest instead of your diaphragm, and it can lead to airway issues. And the orthodontist may want to extract teeth. I don't recommend that. If you suck your thumb, your fingers, a pacifier, it puts a physical barrier in the way of the tongue being able to rest on the roof of the mouth and expand that palate. Your tongue is the best palatal expander. But if you don't have that, it leads to malocclusion. Nasal breathing should be the norm, especially in early childhood. A tongue tie can be a major issue, and the earlier you release it, the better. It can affect the ability to nurse. It might have pain when you're trying to nurse. And so the earlier you get it done, the simpler it is. And then you don't need the therapy. But in older kids, when we're not looking at that and we don't look at that, it can cause problems as they grow. The ideal situation would be to look at a baby's mouth and see if that's tied and have it released the first couple of days they're born. Then it doesn't usually reattach. You could do exercises. There's a huge controversy between breastfeeding and bottle feeding. Breastfeeding is best, not only because of the nutrients, but because your tongue is learning to suck, swallow, breathe, and be up. We prop the baby up. So then they're not getting fluid in their ears. If you can't nurse or you don't want to nurse, you need to at least have a bottle that fits your baby's mouth. We want proper position of the tongue on the roof of the mouth. In many cases, sometimes people require surgery to not only for the tongue tie, but to expand the palate. When you get to kids when they're younger, you can use their growth and development to expand the arch rather than waiting until the sutures in the middle fuse. And then you have to crank open those sutures. So this is important for long-term breathing. Chronic health issues, they affect you long-term. Skeletal remains that they found over 300 years ago show that humans had straight, perfectly aligned teeth, wide jaws, wide, narrow palates, a wider nasal passage. They had a place for their tongue to fit in there. They didn't have as many cavities. They didn't even have toothbrushes and toothpaste. Why? Because they were nasal breathing. Now we're seeing more crowding. They don't have room for their adult teeth, and it affects the alignment. But worst of all, it affects the airway. It changes how they look and how they breathe, and it goes under the radar. We're doing sleep studies on kids, and they're saying they're fine, but they're not. They're being tested for what we test for adults for stopping breathing, and kids aren't stopping breathing. They're just having arousals where they're tossing, turning. It affects their memory, their focus. And these all have greater implications and can cost thousands of dollars to correct with orthodontists, dental therapy, surgery, removing the adenoids and tonsils, or a CPAP machine when you get older. And then chronic conditions happen from breathing this way. We're seeing it. We're living it. We're trying to figure out what caused all of this. We already know the agricultural revolution and our foods changed our diet, changed how we chew, and it's changing our growth and development. It's changing our bones. This affects your whole facial structure. It affects your jaw. It affects the trajectory of growth. It affects your airway. It affects your breathing. It affects your health. We develop compensations because our body is great at compensating. Many adults that are listening to this might identify themselves as chronic mouth breathers. Many won't. If you see these facial changes or you have these facial changes, if you're clenching, grinding, snoring, all of these are signs that you have an airway issue. If you don't feel like you have enough room for your tongue, if you're choking, if you can't swallow pills, if it bothers you when you lay down, you're gagging or choking, not able to breathe. These are all signs of a compromised airway and improper tongue position. In mouth breathing, when the jaw does not develop properly, mouth breathing can create snoring, not enough room for your tongue. And a lot of times they won't outgrow it. So what do you do about it? Mouth breathing seems like an easy habit to correct. Close your mouth, put your tongue out, breathe through your nose, right? Unfortunately, it's not that easy. And there's daytime mouth breathing and nighttime mouth breathing. Daytime is a little easier to treat because you're aware and you're awake. Nighttime is a little harder to treat because it's a little more difficult because you're not aware and you're unconscious. We need to keep our lips together, and we might not notice it or be able to keep it together. Mouth taping is one of the things that we can do, and I have another module on that. But unfortunately, people who struggle with mouth breathing, it's not always that easy, and you have to make sure you can breathe through your nose before you do something like mouth breathing. We have to retrain our brain. We have to reteach you how to breathe, how to keep your tongue and your lips and your mouth together. So it's basically retraining the muscles of the face and mouth because they've been compensating. And by looking at you and doing an extensive evaluation, we can see what's happening there. And they give you exercises to help you retrain those muscles and stop you from breathing through your mouth and start breathing through your nose. When my patients switch from mouth breathing to nose breathing, it changes their quality of life. It's really astonishing. So where do you get help if you or someone in your family are mouth breathing? Contact me, contact another myofunctional therapist, contact an airway dentist, an airway orthodontist. Studies show that mouth breathing is related to incorrect tongue posture, incorrect tone. We call it ITP, incorrect tongue posture. Tongue is in an incorrect position, but we actually can correct these issues with exercises. Sometimes we need more expansion. Sometimes we need to make room for the tongue. Improper tongue position can cause all of this stuff. Chronic fatigue, inability to swallow, if you can't swallow pills, or you feel like you're choking, or you have dry mouth, it could be from medications, mouth breathing. They're all habits that probably formed over years, and it's going to take a little while to untrain what was happening. And a lot of times we're not focusing on the right problems. This is not an obvious problem. So it's easy to ignore the warning signs. A myofunctional therapist can create an individual treatment plan that is right for you to retrain the muscles in your face to help them function properly. And the goals are simple, but it's establishing nasal breathing patterns to eliminate the dysfunction and the habits that are causing this to begin with. So please look at what's happening in your mouth, in your child's mouth, and see what we can do to help you breathe better and sleep better. If you'd like to work with me, click the link below. You can join my Healthy Mouth Moms Facebook group. You can Google a lot of this stuff. You don't have to take my word for it. I'm just here to help.